Good afternoon. Our lecture for today is the conjunctiva. To start with, the conjunctiva is the translucent mucous membrane lining the inner surface of the eyelid, starting from the mucocutaneous junction at the eyelid margin and cover the anterior surface of the globe till the limbus. Histologically, the conjunctiva form from epithelium and stroma. The epithelium non-keratinizing, about 5 cell depth, and in the epithelium there is a goblet cell, that mucin secreting cell. Below the epithelium is the stroma, اللي هو highly vascular connective tissue formed from two layers, superficial adenoid that will not form until 3 months after birth, and this gives the reason why the neonate not able to form follicular conjunctival reaction, a response to viral, for example, conjunctivitis. Below the adenoid layer, there is a deep, thick, fibrous tissue that merge with the tarsal plate, and within this layer there is the accessory lacrimal gland. From the secretion of the goblet cell and the accessory lacrimal gland, the mucin and the secretion of the accessory lacrimal gland form an important component for the tear film. Anatomically, the conjunctiva is subdivided into 3 parts. The palpebral part that adherent to the posterior tarsal plate and represented in the photo by the green line. The second part, fornicial. This part is redundant and thrown into fold. The third part, طبعا الفورنيسيال represented by the red lines. The third part اللي هو visible part of the conjunctiva that cover the anterior sclera and continuous with the cornea, corneal epithelium at the limbus, and here represented by the yellow line. Clinical evaluation of conjunctival inflammation. هنا المقصود بالconjunctival inflammation ممكن يكون allergy، ممكن يكون infective, bacterial, viral، ممكن يكون toxic reaction to certain medication. عموما how to get benefit from signs and symptoms to differentiate each one from the other. فخلي نبدأ بالsymptom of conjunctivitis اللي هي non-specific symptom. ممكن يكون lacrimation with conjunctival discharge، ممكن يكون irritation, stinging, burning, sometimes itching، والitching هي الهول مارك of allergy نعتبرها. لكن بالconjunctival inflammation in general ما راح يكون عندي drop of vision أو significant pain. لما يكون drop of vision أو pain هذه تمشي أكثر ويا الكيراتايتس. Now, types of conjunctival discharge. We have 4 types of conjunctival discharge. ممكن يكون watery. الwatery هو عبارة عن serous exudate and tears و occur in acute viral and acute allergic conjunctivitis. ممكن يكون mucoid discharge. This thick mucoid discharge occurs in chronic allergy, for example, vernal conjunctivitis and in severe dry eye. And it may be mucopurulent discharge as in bacterial conjunctivitis in general. It gives a mucopurulent discharge in chlamydial and acute bacterial conjunctivitis, while in the right photo, the thick creamy white purulent discharge, which is significant for gonococcal conjunctivitis. And now the signs of conjunctival inflammation. After we finish talking about the symptom, now the signs of conjunctival inflammation, and we will start with conjunctival hyperemia or injection, which may be diffuse, but it is more intense away from the limbus, and this differentiates conjunctival inflammation from other serious condition when the maximum injection redness in juxtalimbal area. Circumcorneal injection is an important sign of serious condition. While in conjunctival inflammation, the redness more intense away from the limbus. Subconjunctival hemorrhage may be seen in many conditions we will cover in clinical session, but in conjunctival inflammation we can see subconjunctival hemorrhage. It may occur with viral, especially adenoviral conjunctivitis or hemorrhagic intraviral related conjunctivitis. An important sign of conjunctival inflammation can seen by slit lamp examination to confirm certain diagnosis. We can see the conjunctival follicle. The conjunctival follicle here represents multiple discrete, slightly elevated lesions, most prominent in the fornices. I show you in the photo the black dots here represent the follicular reaction. Histologically هذه الفوليكل هي عبارة عن hyperplasia of lymphoid tissue within the stroma in the superficial adenoid layer of the stroma واللي قلنا it not will be formed before the 3 months not well formed before the 3 months after birth واللي قلنا neonate can't form follicle in response to conjunctival inflammation that cause follicular reaction. هسه نريد نعرف وين ممكن نشوف الfollicular conjunctival reaction. Follicular conjunctival reaction can occur in viral conjunctivitis, chlamydial conjunctivitis, ممكن تكون hypersensitivity to topical medication. فهذه الفوليكل when we see the follicular conjunctival reaction راح يكون عندنا نورو list of differential diagnosis وتكون هي specific sign for this condition that I mentioned. غير الفوليكولار conjunctival reaction إيش ممكن يكون ممكن نشوف بالسليت لامب examination in conjunctival inflammation. عندنا important sign هي البابيلاري conjunctival reaction. ال most prominent site لهذا الرياكشن وين نشوفه راح نشوفه in palpebral upper palpebral conjunctiva and in the limbal bulbar conjunctiva. ليش هالمكانين يحتاج أن تكون الconjunctiva attached to the deeper fibrous tissue. فأما بالupper palpebral conjunctiva فتكون attached to the tarsal plate وبالlimbal bulbar conjunctiva تكون الconjunctiva attached to the deeper fibrous layer. لهذا راح يتكون البابيلاري conjunctival reaction in this site. appearance of this papillary conjunctival reaction شو راح نشوفه as in the picture here we invert the eyelid راح نشوف red dots small red dots elevated slightly elevated dots appear هذه إذا كانت هي micro papillae لكن when it is a macro papillae slightly enlarged less than 1 millimeter ممكن نشوفها ممكن تكون giant papillae more than 1 millimeter more prominent وهنا develop in prolonged inflammation و sometimes there is apical staining with fluorescein نقدر نصبغ الأبيسز of the papillae giant papillae and we may see a mucus strand between the giant papillae which indicate severe active disease. Where we can see the papillary conjunctival reaction, we can see papillary conjunctival reaction in bacterial conjunctivitis, allergic conjunctivitis, in chronic contact lens, in contact lens wearer we can see floppy eye syndrome. يعني wide list of differential diagnosis for papillary. It is less specific than the follicular conjunctival reaction. هذا نوع من أنواع الconjunctival inflammation appearance هو الconjunctival chemosis, a translucent swelling of conjunctiva أو conjunctival edema, which occur in cases of severe inflammation, for example, severe allergy, hypersensitivity response, وممكن نشوف hemorrhagic chemosis in patients with thyroid eye disease. conjunctival membrane. الconjunctival membrane of two types، ممكن يكون true membrane أو pseudo membrane. طبعا هو الممبرين عبارة عن coagulated exudate، ممكن involve the superficial layer of conjunctival epithelium بحيث when we try to remove this lead to tearing of the membrane and bleeding at the site, and this can occur in beta hemolytic streptococcus and diphtheria. لكن السيدو membrane, when this coagulated exudate adherent to the inflamed conjunctival epithelium بحيث we can build easily and leaving the intact and the underlying epithelium intact مثل ما بالصورة when try to build the membrane and we remove as a one piece. طبعا هذا ممكن يصير بالسيفير adenoviral conjunctivitis، بالجونوكوكال، بالستيفن جونسون syndrome. And part of systemic assessment for patient with conjunctival inflammation ممكن تفحص for lymphadenopathy. The preauricular and submandibular lymph nodes should be examined, and lymphadenopathy occur in viral conjunctivitis, chlamydial conjunctivitis, severe gonococcal infection, and in paranoid syndrome. Bacterial conjunctivitis. طبعا simple bacterial conjunctivitis, acute bacterial conjunctivitis هي a common condition and usually self-limiting who occur secondary to direct eye contact with infected secretions. most likely organisms هي ممكن Staphylococcus epidermidis, Staphylococcus aureus, strep, H influenza. خلينا نشوف symptoms of bacterial conjunctivitis. symptoms of bacterial conjunctivitis هي revision اللي ما حكيناه بالسلايدات السابقة. راح يكون non-specific symptoms of conjunctival inflammation اللي هي redness, acute onset of redness, grittiness, burning sensation. زين شنو الtype of conjunctival discharge؟ يبدأ watery but rapidly change to mucopurulent discharge. Okay, on waking the patient found that his eyelid is stuck together and difficult to open the eyelid, high secondary to involvement by conjunctival discharge. Or infection start in one eye and within 1 to 2 days the fellow eye start to be involved. نيجي على signs of bacterial conjunctivitis. أيضا الeyelid edema، الاريثيما اوكي may occur. قلنا lymphadenopathy يعني rarely seen, absent، ما عدا بالجونوكوكال أو meningococcal infection can be seen. نيجي على نوع الconjunctival injection، راح يكون most prominent away from the limbus مثل ما حكينا. نوع الconjunctival reaction راح نشوف papillary conjunctival reaction بالupper palpebral conjunctiva when we invert the eyelid. تمام. نوع الديسشارج هو mucopurulent discharge، بس ممكن يكون thick creamy white pure purulent discharge in gonococcal أو meningococcal infection. الvision normal اوكي، لكن لما يكون عندي corneal involvement for example بالجونوكوكال والمنينجوكوكال اللي بيها high risk of corneal involvement corneal ulceration، هنا ممكن الفيجن يكون affected. هل يحتاج البكتيريال conjunctivitis إلى specific investigation؟ لا، احنا الدايجنوسيس واضحة from the signs and symptoms. نيجي على التريتمنت. احنا عندنا good percent about 60% of the cases resolve within 5 days without treatment. So why we prescribe treatment؟ هنا التريتمنت طبعا هي topical antibiotic eye drops أو eye ointment. We prescribe the treatment هنا to speed the recovery, to prevent reinfection and transmission. وراح ننطي antibiotic eye drops 4 times daily up to 1 week. بنحتاج كل نص ساعة كل ساعة 4 times daily up to 1 week. نوع الانتيبايوتيك اللي نختاره هنا كلورامفينيكول، امينوجلايكوسايد، الكوينالونز اللي هي سيبروفلوكساسين، اوفلوكساسين، ليفوفلوكساسين. اي دروبس اوكي. ممكن ننطي اي اوينتمنت مثلا كلورامفينيكول اي اوينتمنت can be prescribed. as well ما نحتاج systemic antibiotic. topical antibiotic is enough. لكن when we prescribe systemic antibiotic ممكن نحتاجها مثل ما قلنا أكو عندنا certain aggressive conjunctivitis, for example الgonococcal والmeningococcal conjunctivitis. إذن we prescribe systemic antibiotic for these two conditions. أيضا ال H influenza لأن بيها risk of otitis media we prescribe systemic antibiotic. لما يكون هاي conjunctivitis complicated with preseptal or orbital cellulitis also we prescribe antibiotic treatment. نحتاج topical steroid؟ لا، احنا topical steroid ممكن يأخر الريسبونس للانتيبايوتيك، لكن نحتاجه لما يكون for example membranous أو pseudo membranous conjunctivitis، واللي هي هاي يعني rarely occur with bacterial conjunctivitis، نشوفها أكثر ويا الفيرال. أكو certain instruction ننطيها للمريض. الانستركشن اللي ننطيها للمريض، إذا هسه نوصل احنا مسج من هذا إنه بالبكتيريال كونجكتيفايتس ننطي توبيكال انتيبايوتيك، سيستميك ريرلي نحتاجها، ستيرويد ما نحتاج. لكن الانستركشن اللي ننطيها للبيشنت هي ايش راح تكون؟ الانستركشن هي انه مثلا الirrigation frequent eye washing، يغسلها to dilute the excessive discharge especially in hyperpurulent cases، frequent eye washing and frequent hand washing، avoid sharing towels with the family. هذا راح يقلل لنا risk of transmission to other person. إذا كان هو contact lens wearer stop using the contact until 2-3 days after complete resolution، يوقف الcontact lens wearing. طبعا ما يحتاجوا review. most of the patients cured with the antibiotic، لكن if there was any deterioration we ask the patient to come again for examination. هذا كل ما يتعلق بالacute bacterial conjunctivitis. viral conjunctivitis، من نتحدث عن viral conjunctivitis يعني على الأغلب إحنا نتحدث على adenovirus، لأنه most frequently caused by adenovirus infection، اللي راح يكون إما sporadic or occur in epidemics in workplaces، في hospital، schools، swimming pools. The spread of this virus هو highly contagious disease، ويكون caused by direct contact with respiratory or ocular secretions. طبعا ال presentation of viral conjunctivitis هو ممكن يكون mild very mild subclinical cases، وممكن يكون severe inflammation with significant morbidity، لكن على الأغلب there is a history of a close contact with acute conjunctivitis. إذن لازم يكون عندنا history of acute conjunctivitis بالfamily بالworkplace of this patient. symptoms and sign of viral conjunctivitis. طبعا البرزنتيشن راح يكون red eye with eyelid edema, tender preauricular lymphadenopathy with watery conjunctival discharge. On examination there is conjunctival hyperemia, there is follicle follicular conjunctival reaction. ممكن severe inflammation may cause subconjunctival hemorrhage أو conjunctival chemosis أو pseudomembranous conjunctivitis. Again the vision is normal, okay, but if the vision affected this means there is a complication اللي هي ممكن يكون keratitis and adenoviral conjunctivitis. الكيراتايتس in patient with adenoviral keratitis ممكن تكون على شكل punctate epithelial keratitis. punctate epithelial keratitis اللي هي sub epithelial obesities طبعا developed during the second week. احنا patient with viral conjunctivitis اللي يجي with watery conjunctival discharge و follicular reaction والmanifestation اللي حكيناها with vision normal Usually يعني هنا we advise the patient to check his vision during the second week لأنه chance of corneal involvement هو during the second week. فيكون ال corneal involvement either in the form of punctate epithelial keratitis أو على شكل sub-epithelial stromal infiltrate يعني beneath the epithelial lesion there is stromal opasities. Treatment of adenoviral conjunctivitis طبعا there is no specific antiviral agent for the adenovirus. Spontaneous resolution usually occur within 2 to 3 weeks. We have general instruction we give to the patient to reduce chance of transmission. For example, hand hygiene, avoid frequent eye rubbing, stop sharing of the towel. This is important to reduce the chance of transmission. Other measures, stop using contact lens till the complete resolution of the symptom. We use artificial tears for symptomatic relief, cold compresses also for symptomatic relief. When there is pseudomembrane, we try removal of the pseudomembrane, topical antibiotic for secondary bacterial infection. Certain situation we can use topical steroid, weak steroid, for example, in symptomatic pseudomembrane or symptomatic keratitis. I will mention here the types of allergic conjunctivitis. Allergic conjunctivitis could be an acute allergic conjunctivitis. Here the patient has history of watery eye, watery conjunctival discharge, red eye with watery conjunctival discharge, and the itching that we mentioned is the hallmark of allergy, conjunctival chemosis. As a sign by examination, you will find a papillary conjunctival reaction, and mainly on the upper tarsal conjunctiva, you will see a small papillae. This type of allergy that is an acute reaction, conjunctival reaction to an environmental allergen, the condition can be subsided by applying cold compresses, or sometimes we require topical antihistamine eye drop. The second type of allergy, of conjunctival allergy, is a seasonal allergic conjunctivitis, and here the patient may have rhinoconjunctivitis. In addition to ocular manifestation, there is nasal discharge, there is sneezing, it comes in seasons, and here the treatment, the manifestation, the clinical presentation is the same: itching, watery eye, red eye, and conjunctival chemosis. There is also a papillary conjunctival reaction. The treatment is the same, but we may prescribe, in addition to antihistamine eye drops, may we prescribe muscle stabilizer or short topical steroid course. The third type of allergy is the vernal keratoconjunctivitis. Here is the chronic or the recurrent types of allergic conjunctivitis, vernal keratoconjunctivitis, we mentioned in details. It is an interesting topic with a corneal complication. This type is the recurrent bilateral external ocular inflammation affecting typically children and young adults. And this type of allergy is hypersensitivity type 1 and type 4 hypersensitivity reaction. There is a rule for the IgE and cell-mediated immune response. And this interesting topic, the vernal keratoconjunctivitis, has three main types regarding the clinical presentation. It's either palpebral, limbal, or mixed type. In all types, as any type of allergy, the patient presented with red eye, with itching, with here there may be photophobia, and there is photophobia, foreign body sensation, and in palpebral form, the patient may present it with ptosis as well, heavy eyelid, by the conjunctival reaction. As we remember from the story, a young boy about 5-6 years old presented with this feature. And the type of conjunctival discharge here is a thick mucus discharge. In this type of allergy, it's not a watery, it's a thick mucoid discharge. By examination, slit lamp examination in palpebral form, you may see either in the simple type, either a small papillae, a micropapillae or macropapillae, or a giant papillae. And this giant papillae mainly at the upper tarsal conjunctiva. You examine the upper lid at the upper tarsal conjunctiva. These giant papillae with a mucus strand in between these papillae may give the lid a heavy weight, and that lead to ptosis, upper lid ptosis. This is the palpebral form of vernal keratoconjunctivitis that may associated with a corneal complication I will discuss later. The second type is the limbal form. The limbal form in the B photo, you will notice that the reaction, papillary reaction in the limbal conjunctiva, and this is the gelatinous appearance, the papillary reaction at the limbal conjunctiva with a cellular deposit at the apex of the papillae, and this is called a Horner Trantas dot that represent the cellular deposit at the papillae, at the limbal papillae. This is the limbal type, the B photo. Sometimes there is a mixed type. We see the palpebral form with the limbal form, and this is called the mixed type of vernal keratoconjunctivitis. Here, the upper photo is the upper tarsal conjunctiva with a giant papillary reaction. P is the limbal vernal keratoconjunctivitis, a limbal type with a limbal papillae with the discrete white superficial spot, that is the Trantas dot. So the first photo is the palpebral type, and the second photo is the limbal type of vernal keratoconjunctivitis. As I mentioned, this interesting type of allergic conjunctivitis has a corneal complication, and especially in palpebral form due to close proximity of the inflamed conjunctiva to the corneal epithelium. So there may be either punctate epithelial erosions, tiny area of epithelial defect, or macro erosion, when these small erosions get bigger, form macro erosion, or sometimes a mucus plaque that is exposed Bowman membrane, and this exposed Bowman there will be adherent mucin and calcium and will lead formation of mucus plaque that retard epithelial healing. Sometimes there is subepithelial scarring such as in C photo, and in recurrent limbal form there may be subepithelial scarring take the form circular form like in G photo, and this is called pseudogerontoxin. It look like the arca sinalis in a patient with a recurrent limbal vernal keratoconjunctivitis. How we treat this patient, this boy with a vernal keratoconjunctivitis. Topical steroid is the mainstay treatment for this condition, and we have low potency or we have a potent steroid, topical steroid. Both should use with caution. For acute exacerbation, for severe symptom of vernal keratoconjunctivitis, we can prescribe, but with we prescribe steroid with frequent measuring of intraocular pressure, and we try to taper the steroid as far as we can to prevent the development of glaucoma in response to topical steroid. The second line of treatment is the mast cell stabilizer. We can use mast cell stabilizer, antihistamine, or combined drug that contain mast cell stabilizer and antihistamine, combined eye drops. Other type of treatment, of topical treatment, we can prescribe, for example, topical acetylcysteine eye drops for mucus plaque in patient with a mucus plaque, and in certain condition when our patient don't respond well to intensive medication with topical steroid, antihistamine, and mast cell stabilizer, or sometime when we try to taper steroid there is a deterioration of the condition, so we use immune modulator as a steroid sparing agent here, like topical cyclosporine eye drop or tacrolimus eye ointment as immune modulator, used as a steroid sparing agent, or for patient who doesn't have a good response to topical steroid. Another type of treatment, supratarsal steroid injection, also we use for a patient with giant papillae for aggressive palpebral form who doesn't respond to conventional therapy. We can use supratarsal steroid injection with topical analgesic cover. Also, we can do debridement for the mucin plaque as well to enhance the epithelial formation, epithelial healing. Sometimes we use also either amniotic membrane grafting or lamellar keratectomy for a patient with a scarring, that subepithelial significant scarring that affect the vision.